Good morning, students. Today we are continuing with the third class of nursing research of the unit first. Now, in the previous classes, we have learned about the introductory aspect about the four important persons we have to remember, and then we continued with the meaning of nursing research, definition of research, scientific research, and nursing research, and different comparisons with the research and problem solving. Today we are discussing about what is the need for nursing research first. That means that why nurses should do research. In other ways, what will happen if we are not conducting research? So that's what we are going to discuss. What is the need for nursing research? The first need is to maintain improvements in nursing practice. There is a change in the PowerPoint. The first need is meet challenges. Now there are numerous challenges are there in front of us. For example, there are a lot of new diseases are coming into the world. Now at present we are facing the COVID-19 pandemic. Only we have started this online classes because of the lockdown due to the COVID-19. That's a new pandemic, a new challenge. And this is not the new challenge actually. From 1983 onwards, the HIV AIDS infection, Ebola virus infections, Honda virus infections, MRSA, methicillin resistant Staphylococcus aureus infections. So there are numerous type of new organisms are coming into this world. And at the same time, there are so many diseases that we thought controlled previously are re-emerging. For example, tuberculosis, which we thought that it was controlled completely, but due to the coexistence with the HIV AIDS, it is re-emerging. So emerging diseases, re-emerging diseases are challenges to nursing profession. How we have to take care of these patients? What are the modifications needed? For that, new treatment modalities are coming, new medicines are coming, new policies are developed, new machines are coming. In order to cope up with all these changes and to add more changes to nursing care and care of the sick person, we need to do a lot of inventions, and for that research is needed. So in order to meet all these challenges, we should conduct research. Then the second need is to develop, refine, and expand nursing's body of knowledge. Now we have a nursing body of knowledge, but we know that from traditionally our knowledge is limited to bed making patient, hygienic care, or care similar to that. But we have to redefine what is nursing, and we have to develop the body of the present knowledge. then only nursing becomes science. We know that there are a lot of differences between arts and science. Nursing is an art and science. And why it is science? Because we have our own nursing theories, principles, and we are applying this nursing theory into the practice. That is why we we consider nursing as a science. And for so we have to expand our body of knowledge also. And this expansion of body of knowledge is done through research. And the new knowledge that is derived from the research and new grouping of knowledge, new linking of knowledge with the other disciplines, all this will add to the body of knowledge in nursing. Then what is existing we have to refine also. That is why research is needed to develop, refine, and expand nursing's body of knowledge. The third need is public demand for quality of life. Now see, nowadays human beings are not concerned with the disease alone, but their quality of life also. Now there is a hue and cry for improving the quality of their life. Now in the olden days, if people become sick, their aim is only to get the treatment and get rid of the disease. But now patients want quality of life also. That is why all the modern hospitals are built in 4-star or 5-star facilities to meet the demand for quality of life. In majority of the hospital, newly built corporate and non-corporate hospitals, you can see that fully air-conditioned rooms and buildings, good canteen facilities, even with the spa, reading libraries, so many facilities inside the hospital. That's why I said it's a 5-star hospitals. This is mainly because of the public demand for quality of life. So in order to meet their demand, we have to research on how we can develop that. What is their demand? We have to identify the demand on the patients or their relatives, and based on the demand we have to improve the quality of the hospital, to improve the quality of life of patients and relatives. So we have to conduct research, then find solutions to problems and issues in nursing practice. There are a lot of issues are there in nursing practice, because sometimes the staff requirement is not met properly, staff patient ratio is not maintained, there are a lot of infrastructural deficiency to give nursing care, and equipment problem will be there, and maybe the salary and administration is not improving or not adequate. So in order to find solutions to numerous problems faced in the nursing practice, for improving the quality, for continuing educations, etc., what we can do, that again demand for more research. Then the next need is help to define parameters of nursing. In the first year BSc nursing class, you have learned about the definition of nursing. What is nursing? Just try to remember at least one definition of nursing. Nursing, the need for nursing is universal, and there are numerous definitions are there for the nursing. Later the Nanda has defined nursing. So all this definition, you can see that some of the definitions are somewhat complete, some of the definitions are incomplete. But when nursing progresses to the modern era, we have to redefine nursing, which include more components and different aspect of nursing. Like that there are four important concepts are there in nursing: who is a nurse, who is a patient, what is nursing, what is environment, etc. So these components need to be refined and defined further. And all the activities what a nurse supposed to do, there are a lot of activities can be done by an untrained person is doing by a nurse. Whether we can give this work to uh, associate nurses or assistant nurses, whether we had to do the nurses at present, we consider the nurse's job as the bed making or some of the clerical work can be handed over to others. And where the real nursing starts, where it ends, what is the boundary for nursing, and whether independent practice is allowed. You know that in India we have started independent practice for nurses, and in West Bengal the maternity independent practitioners have already registered and started functioning. In the from this year onwards, nurses are appointed as the MLHPs, and I have given training for our final year students related to MLHP, because the government of India is planning to appoint middle level health providers as those graduate nurses will be appointed as middle level health providers in the sub centers. They are the independent, going to become the independent practitioners. So this is defining further about what is the role of nurse, who is a nurse. So our paradigm is changing. So in order to define all these things, we should conduct research. Now, coming to the next slide, the need is maintain improvements in nursing practice. We are already practicing nursing. Lot of improvements are there, but in comparison to other field of science, especially in comparison with modern medicine or even Ayurvedic medicines, the developments that are taking place in our profession is at very slow pace. This is mainly because lack of research. Once we complete our studies, we are stopping studying. We never open our book once we become the practitioners. We just simply do nursing work and never think like doing research, publishing paper, and communicating the findings to others. This is why the pace and the speed or velocity of the professional growth is less or retarded in comparison to other professions. So in order to maintain improvements in nursing practice, we should conduct more and more research. We should publish all this research work and communicate the findings to others. Because once we do research work, normally others will accept. Acceptability of the profession is very less among other professionals. It's mainly because of the mechanical work rather than the creative, scientific, and innovative work. So we have to focus more and more on innovations. That should we start from the student period onwards. And in order to maintain the improvements in nursing practice, we should conduct research. So the next need, as I mentioned, to accelerate planning, implementation, and evaluation of nursing practice. Research is a planned activity. For all planning, in order to accelerate the planning and implementation and evaluation of nursing practices, we need the help of nursing research. Now I'll give you an example. In around 40 years back in Christian Medical College, Vellore, there was a practice when doctors take rounds. One helping nurse will walk with a basin of water and a towel along with the doctor's team. Every doctor, after examining the patient, they wash their hands in the basin carried by an associate nurse and wipe in the towel, and then they will go to the next patient. The nursing superintendent at that time found that this is not a good practice. So in order to say that, she need some evidence. As the last point, again we are coming to that, evidences. So what she did is, she took swab from every day's water at the end of the rounds and given for culture in the microbiology lab, and at the end she said that this practice should be stopped because the culture report came with the multiple organisms in the hand washing water when the basin is carried. So there is evidence, clear-cut evidence. Nobody can reject the request of the nursing superintendent saying to stop the practice because sufficient evidences are there. She is talking with evidence, and these evidences she has generated with the data that is collected. So this is how we have to do nursing practice, changes in nursing practice. Again, another need is helps to render cost-effective healthcare. Now, I have mentioned that the people's demand is increasing. The quality of life is changing. The quality, what we thought 20 years back, is not the quality at present. And it is again different from the quality 50 years back. And after 20 years, the quality will again, the demand and the quality will become again more and more. We can predict, but sometimes it is unpredictable also. So but at the same time, majority of the people are not able to meet the cost of these changes. Now we know that in a private hospitals, the change in the cost of a private hospital to a corporate hospital for the same treatment is different. That we will get free in the government hospitals. So the cost, there are a lot of variations are there. Majority of the people are not able to afford the costs. So how we can give more effective care with less cost, that is cost effective healthcare. So the nurses should conduct research to how we can reduce the cost, at the same time increase the effectiveness. So this is cost effective healthcare. So in order to that, we should conduct nursing research. Then finally, we have to supply evidence to promote evidence-based nursing practice. Certainly we know that several practices should be changed. Several practices need to be promoted. Several practices need to be modified. So for all these things we need evidence. Evidence is the needed for medical changes, evidence based medicine, evidence based nursing. We need evidences. So these evidences are mainly supplied by conducting research. Research, we generate data, we collect data. So these are the evidences for changes in practice. So these are the we have discussed about what is the need for nursing research. Next we are going to discuss about the purpose of nursing research. The purpose is why we are conducting research. What are the different purposes of that? Mainly there are 5 purposes, and these purposes are developed from basically from a theory, because we do research based on a theory, and another purpose of research is to develop a theory. So theory is an part and parcel of research. So why we are doing research? These are the purposes: identification, description, exploration, explanation, prediction, and control. So the first thing is the identification. We have to identify several phenomena by conducting research. That is a basic purpose. Identify, that is by just noticing or finding out why this is occurring, how this phenomena happens. We conduct survey researches, we do observational researches in order to identify something. We get opinions, we identify the knowledge of the people to identify a phenomena. So this is identification. That is a basic level of research, or the first level of research or purpose. Identification, identify something. For example, we have identified that there is a spread of a disease in some place. This is identification by collecting data. Second purpose is description. After identification, only the description comes. We have to describe a phenomena. This is descriptive research. For example, we are describing the epidemiology of a disease. Who is causing, what is the agent, who are all affected with the disease, and what time it is causing, how the disease is spread. So this is description, basic description. That comes after identification. Then comes the exploration research. That is the third purpose. This is little more than identification and description. Here we are going into the depth. We are exploring, we are excavating the findings. We are trying to find out some relationship. We are trying to find out why it is occurring, how it is occurring, when it is occurring, why it is occurring, etc. So this is exploration. So this is a higher form of research. We are trying to find out different type of relationship and why this relationship is there. You will be remembering in the epidemiology classes, there are numerous forms of you have studied. For example, the web of causation of the disease. There are numerous type of relationship between the different variables, and this relationship is like the web or a net connections. There are multiple connections are there between numerous variables. We have to explore all these things. So this is exploration. Once exploration is done, then is the explanation. That is the purpose. You have to explain this. Then finally, its purpose is prediction and control. So once we have explored and explained, informed others, we are able to predict. How we can do the prediction? For example, we can say that in every cold season, there is a chance of MRSA infection, SARS infection, or the hospital which have less uh, clean as a chance of MRSA. So this type of prediction is possible in rainy season. There is a chance of diarrheal disease, cholera outbreak can occur in some places. These are the predictions. This is based on the previous research, based on some of the data, based on the intuition of the researcher, etc. We predict. Once we do the prediction, we are able to control. We can take control measures so that we can prevent the occurrence of the phenomena or the disease. So this is the prediction and control. That is again role of theories also. Theories, once we develop, we are able to predict and control phenomena using theories. So these are the purposes of nursing research: identification, description, exploration, explanation, prediction, and control. Now next we are seeing the next topic is research as a scientific method. Nursing is a science, research is a science, and is a scientific method. For that, first we have to learn about what is science. Science is a systematized knowledge derived from observations, study, and experimentation. This is the definition taken from Webster's dictionary. So science, whatever it is, nursing, physics, chemistry, all these things are the science, is systematized knowledge. So the whole knowledge we have arranged properly. There is a classification is there, we call it nosology. A classification is there. Everything is very well arranged. So that is systematized knowledge. And this knowledge is derived from numerous observations by numerous scientists, numerous studies, and by conducting several experiments. And the end result of all these observations, all the studies and experiments, we are systematizing the related knowledge into a field of science. So this is science. There is one more definition. Science is a branch of knowledge concerned with establishing and systematizing facts, principles, methods, and theories. The meaning is somewhat same. Here there is also a branch of science, knowledge concerned with establishing or systematizing facts, principles, methods, and theories together as science. Now, what is a scientific method then? Scientific method is a systematic and orderly arrangement of knowledge which include facts, principles, and theories that is derived from observation, study, and experimentation. Scientific method involves all sets of orderly, disciplined investigations to acquire information and form a system of knowledge. I'll repeat once more. Scientific method is the systematic and orderly arrangement of knowledge which include facts, principles, and theories that is derived from observations, studies, and experimentation, as we have seen in the definition of science. Scientific method involves all set of orderly, disciplined investigations to acquire information and form a system of knowledge. Now, what is the purpose of scientific method? The purpose of scientific method is same as purpose of research also, because research is a science, nursing is a science. So the steps of and purposes of science and scientific method becomes the steps and purposes of nursing research also. So there are a lot of connections between these points, and there is no need to be confused. You can write these points for there also. So purposes include generating scientific informations, testing derived informations, systematic and orderly arrangement of tested knowledge, use of knowledge for the benefit of the community. So all these things are interrelated, and the points we are going to discuss also here, it is interrelated. See, the first aspect or the first purpose is generating scientific information. We need more and more scientific information. This need to be generated, then only the professional growth will be there. That becomes a science only when we generate more and more scientific information. And this information need testing also. The science always need to be tested. That is why in the previous class we found that testing and retesting should be done. Sometimes we get more refined information. Sometimes we prove that this information is wrong and we find out the right one, etc. So testing is needed. Then systematic and orderly arrangement of the tested knowledge, that is also research and science. The developed knowledge we have to arrange properly, and this arrangement should be systematic and orderly. Then use of knowledge for the benefit of the community. We have to utilize the knowledge. That is the ultimate aspect of that. For example, if you are looking at the engineering field, the computer expert is finding out something and they are disposing that to the community so that this type of classes is possible. A document that can be signed by me, that is generated kilometers away in America, document is generated the same time I can sign by sitting at Thrissur and send it back. So these type of development are taking place for the benefit of the community. In the vehicle itself, numerous engineering technologies are developed, and this will be utilized for the benefit of the community. So similarly, the research in any science, including nursing, we should utilize for the development of the community. Then these are the characteristics of scientific method. This is always based on a system. It consists of several steps, and all steps are orderly, and all steps are important, equally important also. Then it is derived from observations, study, or experimentation, or by all these things. It consists of facts, generalizations, principles, or theories. It is always based on the empirical findings generated are based on concrete human experiences. It provides dependable information, helps to predict phenomena with accuracy, applicable in identical environment. It is objective. So these are the characteristics of research also. All the wordings are important. I'll repeat once more. The characteristics of scientific method include based on a system. It consists of several steps. All steps are orderly, derived from observations, study, or experimentation. It consists of facts, generalizations, principles, or theories. Empirical findings generated are based on concrete human experience. It provides dependable information, helps to predict phenomena with accuracy, applicable in identical environment, and it is objective. These are the steps in conducting research. It's a scientific method. Identify a topic first. After identification, you have to formulate into a problem, a researchable problem, a formulate problem. And after that, you develop your objectives and state those objectives. It can be a single objective or it can be many objectives. Then you should do the literature reading, review literature, and discuss with the scientific community, including your experienced persons, your guiding persons, etc. Formulate hypothesis, that is the prediction. You have to predict. Describe designs study and methods for data collection, and based on the method collect data, then analyze and interpret the data, then you systematize your finding, arrange the findings, then communicate the findings to others. These are the characteristics of a good research. A good research and a scientific method. Especially if somebody asks for the examination, what are the characteristics of good research? These are the characteristics. A good research is always systematic, it is controlled, disciplined, logical, objective, empirical, and critical. Every characteristic is important. What is systematic? Research, the whole research is a systematic process. If your research is going through all steps by spending sufficient time in each step, a very well planned, done with less errors or no errors, is going to be a good research. Now you can compare good research with a good human being. Now whenever we say that a student is a very good student, you can see these characteristics in that particular person also. Will be very systematic, will be having good control of emotions and very well controlled by themselves, will be disciplined, isn't it? So these are the qualities of human beings also. The second thing is it's controlled. Here the control, along with the definition I mentioned, that the researcher will control the variable studied, dependent, independent variable studied is a very well controlled. Only the researcher, according to the researcher's plan, only the variables will move, the independent variable and dependent variable. The researcher will try to change independent variable and will measure what is the change that is occurring in the dependent variable because of the changes that are taking place in the independent variable. That's very well controlled. Researcher also control all the external variables that may affect these variables and kept all the other variables as constant, that will not affect these variables at all. Just like how the parents control the external friendship, unwanted friendship, unnecessary friendship to their children, and they become uncontrolled, isn't it? So this is how the researcher will control all the external variables that should not control the internal variables under study. So this much strict control will be exhibited, and there will be an experimental group and a control group in the study, and this control group also will be kept as a constant always. So this is a control. If good control is there, that is always a good research. As the control is reduced, more errors will creep in, more errors will occur, and the quality or the goodness of the research will reduce. Then a good research will be always a disciplined one. only according to the plan it will proceed. In other ways, some rigidity is needed, even though research needs flexibility, but that is a controlled flexibility. It's a controlled freedom. Controlled flexibility is there. Everything is well planned, is good disciplined. Now we can see that when if you are visiting a tea plantation somewhere in the hilly area, you can from a distance you can see the beauty of that plantation, mainly because it is well disciplined. The height is cut properly, it is maintained like that. So this is a discipline. So discipline, highly disciplined study is always a good study. A good research is always have logical connections. It's always logical. Everything is logical. A good research is always objective also. The subjectivity of the researcher will not play at all. Everything is based on the observations and measurements, and it is recorded the same way. There is no foul playing, there is no fraudulent activities in the research. And the subjectivity or the values of the researcher have no values in research. It's always objective. So a objective research is always a good research. Then next is empirical. So what is the meaning of empirical? Empirical means something is true when we can experience with all our senses, all our five senses. Then only that becomes true. If we are able to observe a phenomena, if we are able to measure a phenomena, if we are able to experience the phenomena through our five senses, either by taste or smell, then only we accept that as a data. This is the empirical nature. So a good research is always we are able to measure, we are able to observe, and we are able to see the changes. Otherwise, predictions will not work at all. We cannot assume things in research. So research, good research is always empirical. Finally, a good research is critical. Now everybody who's reading the research can criticize that. There should be discussions and criticisms. Research, good research allows criticism. It is always even the critical also. The research finding is critical also. So in all these things, a good research is critical. So what are the characteristics of a good research? It is systematic, controlled, disciplined, logical, objective, empirical, and critical. Again, we have more additional points also there. A good research at the same time is replicable. What is replicable means? If you are we have conducted research at the Thrissur in Amala Medical College Hospital, and if you do the same research at Jubilee Medical College Hospital, the similar population using the same methodology, we should get the same result. Not only at Jubilee, at any hospital with a similar population or similar condition, anywhere in the world, we should get the same result. This is the replicability. So research conducted in a good manner, using good sound methodology, that research is always replicable. Lack of bias is another characteristics. Research should not contain any bias or errors. Naturally, a very strictly disciplined research, there should not be any bias. For example, the experimental or the clinical trials, there should not be any errors or bias. There is no room for any errors. But whereas the non-experimental studies, there are chance of lot of bias or errors. A good research is always verifiable, and researcher and the data need frankness and truth, and we have learned along the qualities of our Mahatma Gandhi, the truth. I have mentioned that good research is always rigid, but it allows some flexibility also, especially for non-experimental research, for example, historical research, or a qualitative research is another branch of research where we consider the quality research. Flexibility is more important. We are able to collect more data by flexibility. Even we have a rigid plan, but if we stick on to the rigidity, we will not get the complete data. Only during the course of study, we evolve methodology. We find out some new persons at the time of data collection only. So some changes in the methodology, the methodology itself demand change. So the flexibility also needed for some good researchers. And we have to use appropriate suitable methodology. So these are the characteristics of a good research. Again, a good research need confidentiality. So many aspects we should kept confidential. That is the ethics of research also. The information collected from the subject we have to keep at cost confidential. At the same time, this can be used for publishing without any identification of the subject. So that confidentiality should be maintained throughout. Then sufficient and appropriate use of data is needed. Whatever the data is collected, we have to use it for maximum purpose. A good design of the study always says that maximum utilization of the minimum data. Collect data and use it for the maximum purpose, so there's sufficient and appropriate use of data. Then all research need generalizability. Even though we are collecting data from the samples as a subset, that should be generalized with the whole population. So if you are doing a research in a scientific way, your findings is always generalizable to the whole population. And again, a good research is communicated efficiently and effectively. In the initial class, we have learned from Florence Nightingale and the father of modern genetics, Gregor Mendel. They have communicated effectively. So a good research is always communicated efficiently and later leads to utilization of findings. So these are the characteristics of good research. So today we have learned 3 important points, mainly about the need for research, scientific method, and the characteristics of good research. And in the next class we will learn about different steps involved in research process. So all of you have to write notes on this and prepare your notes well.